All right. Hey, Rob.
Yep.
You here? All right, everyone. Thank you for joining us this afternoon. We welcome everyone, and we're going to go ahead and just dive right in. So we want to thank you for joining us. We're going to try and make this kind of a quick, high-level interview with Priority Health. We have Rob Roberts with us this morning, and both Rob has a few slides he's going to take everyone through, and then we have a few questions we're going to ask Rob, talk a little bit about both reasons why agents are selling and choosing to sell Priority Health this year, where they've positioned themselves in the market, and also some of the best practices that they're seeing out there that agents who are being consistent, writing business, and doing a larger volume of business, what they're doing to prepare themselves and to make this a successful AEP. So we're hoping to give everyone a real quick, high-level overview of both the product, the AEP, and again, what agents are doing out there to be successful. So I want to thank Rob for joining us. Thank all of you for joining us. I know it's a busy time of year. This will also be recorded. So if you want to revisit this on some of our channels, feel free to do so. With that, Rob, I'm going to turn it over to you and let you get us started.
All right. Hopefully you guys can see this. Thanks for the time, guys. I appreciate the opportunity. I know this is a very busy time of year, and we certainly appreciate the opportunity to just kind of review a few things about Priority Health. So as Jason mentioned, I've got a few slides we'll kind of run through at relatively high level. And then we can kind of drill down from there, and I'll stay on as long as you guys might need me to answer any questions or have that discussion, etc. So to start off with, just a reminder here: Priority Health has received a 5-star rating for 2023 on our HMO POS product. We actually have 4 products within the HMO POS classification. 2 kind of legacy plans that have a premium you won't sell, 2 that are really good plans that you will be able to sell through that 5-star SEP all year round. So if it's anything, if you guys are kind of experiencing anything like I have been hearing back from agents that this is just kind of a slower SEP, that 5-star with Priority Health in the key plan and the one plan will helpfully be a way for you to kind of make up for a lack of those sales during AEP on the back end. Now that 5-star SEP begins December 8th, so the day after AEP, and then actually, so December 8th, 2022, and then runs all the way through the entire 2023 calendar year till November 30th, 2023. Key plan is a very popular plan. It's available in all 68 counties in the lower peninsula. So if you get that oddball referral somewhere that you don't normally do business with, you're still going to have a 5-star SEP option to enroll that beneficiary in throughout the entire year. The key plan, a little nuance here, the key plan is actually the most popular plan in the state of Michigan. There are more beneficiaries enrolled in the plan than any other plan in the state of Michigan. So lucky, you might want to call it, that we got this very popular plan available in all 68 counties that we're lucky enough to get that 5-star on. So I think this would be a great way to kind of make up for any lack of sales during AEP throughout the year, as well as the one plan. The one plan is a new plan this year with us. It was through our Beaumont initiative, much smaller footprint, slightly better benefits. Believe that or not, that can be located in Wayne, Oakland, Macomb, as well as Kent and Ottawa. So just southeast and on the west side. But bottom line here is that 5-star, you'll be able to enroll beneficiaries year round, which is a really nice thing. So just real quickly, I don't know if you guys were familiar with this. I was not familiar with this before I came to Priority Health about 6-7 months ago. But just recent years, Priority actually overtook Blue Cross Blue Shield as the #1 carrier for Medicare in the state of Michigan. I think there's a number of reasons for that. One of which I just mentioned, which is Priority Health is a great catch-all. We're a great catch-all carrier. A couple of things that separate us. We have a PPO, an HMO POS, and a DSNP in all 68 counties in the lower peninsula. We have the best provider directory. I don't know if I'm allowed to say that, but I'm going to anyways. It is the best provider directory. 97% of PCPs, every major health system participates. There's one tiny little health system up in the tip of the thumb. I think it has 150 beds, is the only one that doesn't participate. We have a solution in all 68 counties. We have the best provider directory. And one of the things that we talk about is access to care, right? So that provider directory that I just referred to, that is really second to none, it's the same provider directory for our PPO, our HMO POS, and for those of you in the DSNP market, our DSNP product as well. And that's one area where we really separate ourselves from the competition in the DSNP market. Access care. They can actually use the benefits that you've sold them, which is wonderful. We don't require any referrals to in-network specialists in any of those three products. PPO, HMO POS, as well as DSNP. Again, access to that care we talked about. And then on our PPO and our HMO POS, we actually have our TravelPass, which allows beneficiaries to go anywhere in the US outside of Michigan, seek services from a provider that accepts Medicare and will be billed as in-network. Our DSNP product does not allow that because Medicaid needs to be billed, and that Medicaid is a Michigan-based. I think for those reasons right there, we were able to really make some steps on Blue Cross Blue Shield just recently over the last few years and actually overtake them. So for those of you who aren't as familiar with us, what I've told agents, particularly in the Southeast side, is that we're a great backup. Even if we're not your number one, we're a great backup carrier for all those reasons. We're a great catch-all. So if your number one carrier is, say, a local regional carrier or a national carrier, but the doctor doesn't participate, the formulary may be not as good, or you get a referral from a county you don't normally do business in, Priority Health will have a solution for you, right? For all three of those reasons. I don't know if I had mentioned that the formulary is the same for all three plan types as well. So our PPO, our HMO POS, as well as our DSNP. So just kind of cleaner, simpler, accessible, great provider directory, and a couple of highlights there. Now, we don't work for free, so we actually pay commissions. This is kind of new. Last year, we made improvements to it this year for 2023. We will pay $100 for our HRA, our health risk assessment. It pops right up on our new enrollment platform powered by Connexure. Immediately following the submission of an electronic application, or if you have a paper app, you can enter it electronically. So however you choose to enter that application on our Connexure platform, it will immediately go to the health risk assessment. You get paid $25 to simply click morning, afternoon, or evening, and then type in the beneficiary's number, and then $75 to actually complete the health risk assessment. No need for us to actually make contact with the beneficiary regarding the welcome call. No need to have the welcome call completed, because we all know that beneficiaries don't answer with the same frequency they have in the years past. The only issue there is that needs to be completed, and that will pay out for any new to Priority Health beneficiary that you enroll. Okay, so I mentioned a little bit about this already. No referrals required for in-network providers. New, however, for 2023, the TravelPass. This is where I mentioned you can go anywhere in the US, seek services from a provider that accepts Medicare and be billed as in-network for both our PPO and our HMO POS plans. So for 2023, that includes the UP. So the UP, a beneficiary can now go to the UP, and even though that's still part of Michigan, they can seek services with a Medicare provider and be billed as in-network. So that's new for 2023. And then we also have three plans that actually have an open network. The Priority Medicare plus Kroger, DSNP, our Priority Medicare, the non-DSNP product. Of course, our DSNP wouldn't have an open network. So our Kroger non-DSNP product, which is our PPO, our Priority Medicare Compass, which is also a PPO, and the Vital, which is also a PPO. So those three plans, I'll talk a little bit more about the Vital plan. That's a really good plan this year. We've seen some great strides in regards to that plan. I'll review a little bit here shortly. But those three plans have an open network. Well, what does that mean? I can already go anywhere in the US, including the UP, right? Seek services from a provider that accepts Medicare and be billed as in-network. So all this, what is going to allow you to do is seek those providers in the lower peninsula of Michigan who are non-par but accept Medicare and still be billed as in-network. So access to care. we mentioned before. A couple things that also kind of separate us from the crowd: unlimited emergent and urgent care anywhere in the world. Now, I know carriers are required to cover urgent and emergent care, but it's my understanding that a lot of carriers have migrated to that cap of 50,000. We are still unlimited. I believe we may be the only carrier there. So if you do have beneficiaries that do a lot of traveling, something to keep in mind, particularly out of the country, right? With our plans also comes Assist America, which is a global emergency travel assistance program. I think, guys, pretty familiar with that. I think a lot of carriers offer that. You only have to be 100 miles from home to actually have that kick in. Looks like there's a question: are the personal URLs available this year so we can share them for beneficiaries? Yeah, so in our Connecture platform, as you log into the Agent Center and click on the 2023 enrollment tile, you can actually send a quote to a beneficiary. And if they enroll from that, you will receive credit for that enrollment. We refer to them as pearls. So you kind of have a link, right, that you can email a beneficiary. They click on that link. So now we can just do it through a quote. If you go in, enter the profile of the beneficiary, go to plans, send quote, you can send up to 3 plans in a quote. That beneficiary receives that email and that communication, has the ability to enroll, and your contact information, your agent information is auto built into that application that they do. So I guess the answer to that is yes. A couple of things here that I'm just going to kind of touch on real quickly. These are what we have in all of our plans, and some of them stand out. Some of them are kind of familiar with some of the other carriers as well. We do have a 0 in-network deductible for medical on our HMO POS plans, and a 0 combined deductible for in and out of network on our PPO plans. I don't know that that's kind of across the board with all other carriers. 0 copay for virtual visits, including PCPs and specialists. 0 virtual behavioral health providers and digital wellness tools as well. $0 copay for free to talk. This becomes wellness. I don't know if you guys have ever kind of experienced where you tell your beneficiary wellness is a 0 copay, and then you get that call, well, how come I was charged, a copay? Well, beneficiary, a doctor says in the wellness call, how are you doing? And your client says, oh, well, this aches, that aches, this is painful, that's painful. And so then it comes from wellness to diagnostic. And so one of the things that we've done is free to talk. We want that wellness to be a 0 copay. And so there's a whole list of services that can be generated from a wellness call that will still remain a $0 copay for wellness. This is kind of interesting. I think this is unique as well. A flat fee for observation. For those of you who are familiar with observation, maybe somebody goes into the ER, they're not admitted, they just want to be held over for observation. It's a flat copay for observation. I know a lot of carriers don't do that. I believe around our average is $110 for observation. All services done while being in observation is covered under that 110. So that's kind of nice. It does include mom's meals. So that's included in all plans. Let's see, no referrals for networks providers. We kind of talked about that already. Drug costs, $0 copay for 90-day supply. I think that's pretty common these days. A $0 copay for 90-day supply of tier 2 insulins, Humalog, Humulin, and Limjev, or our formulary covered insulins, right, that are going to be covered $35 or less. One little nuance here, I will say, an agent brought to our attention: if you use Medicare.gov as a kind of a weeding out process to find the best plan for your beneficiary, our formulary insulins are not coming up on Medicare.gov as $35 or less. So just keep that in mind if you're using Medicare.gov and looking for us. If you factor in formulary costs, prescription costs, we may not show up as competitive if you're entering an insulin in there. Again, we're working on getting that corrected so that it's accurate, but just keep in mind, we're just like every other carrier due to the Inflation Reduction Act. Any formulary insulin, not medication, but any formulary insulin does have to be covered at $35 or less. And then we have, dental, vision, hearing that's embedded, including silver sneakers that's embedded in all of our plans. I will say in regards to our dental, we have cleanings, x-rays embedded in all our plans with no cap. And those costs do not go towards the dental benefit cap, right? So let's say you include the enhanced dental, vision, etc. So that is just separate. That's not going to be added towards that total for the dental. And then the TravelPass we kind of talked about real quick. One last thing that I'm just going to kind of demonstrate real quick. I think we're 15, 18 minutes in, so I think we're doing okay. We have had feedback from agents indicate that, boy, you guys have a lot of plans. Half of our plans are legacy plans that have kind of a premium tied to them. You're probably not going to sell. But our marketing team developed this interactive PDF, which I will send out to everybody, that helps kind of filter the top plans, the top 3 plans, based on the county that the beneficiary resides in. And so first step that you take in regards to this is you either select non-DSNP or DSNP, a map of Michigan then pops up. You're simply going to click on the county the beneficiary resides, and it will take you to the top 3 plans in that county. So I clicked on Macomb County. Here we have the Plus Kroger, the Vital, and the One, right? So 2 of the new plans, and then that Vital plan that I told you about. Gives you a brief overview, and then if you actually click on plan, it'll take you right to the sell sheet for it. Kind of gives you an overview of what's in that plan, the benefits, right? It's kind of like a 1-page front and back with all those plans on here. So if you're sitting there talking to a beneficiary on the phone, or you're going to be seeing with see a beneficiary in person, they're going to come to your office, you're going to go with them. This is a way to kind of filter those plans out ahead of time, so to speak. The nice thing about our sell sheets as well is that you can actually put your contact information on here and leave it as a leave behind. So they have your contact information as well. Print that out. So just a couple of ideas there for you. Okay, so any questions? There's our contact information for all of our sales reps as well. Is everyone aware of the new platform and how to get a quote? That's a good question. All right. If not, I would be happy to do kind of a walkthrough of our new enrollment tool for IAD. Jason, if you think there's a need for that, I'm happy to kind of do that. We did have trainings throughout leading up to AEP. It's a busy time of year, though. Agents are trying to get certified and not always able to kind of get everything done that they may want to. So we do have a new enrollment connector platform for 2023, and it looks very similar to Medicare.gov. I believe that's a connector platform, and some of the other carriers as well. It is a very nice kind of user-friendly platform, pretty intuitive. I can get in there and kind of navigate around pretty quickly without any instruction. That's saying a lot. That's saying a lot. However, I would be more than happy to do kind of a walkthrough of that for you guys. I could probably do it now if anyone has time for that.
Hey, Rob, we don't have time for that walkthrough today, so we'll have to reserve that for another time. But yeah, if you have any questions, please contact us. Let's dive into just a few questions we've been getting from the field, and then we'll wrap this up so we don't hold everyone up. So a quick question for you and kind of what you're hearing in the field, what you as a carrier is experiencing, but how do you see this AEP? How is it starting off for you guys?
Yeah, I would say, if you're experiencing a little slower AEP than normal, you are not alone. I will say that I have heard this from a lot of agents, including our elite agents. I had one of our elite agents reach out to me, and she kind of does her own branding, marketing. She said normally that she has leads coming in all throughout AEP with apps following. She indicated that a couple of weeks into AEP, and she's already written all the apps from the leads that have come in so far, and now she's still got 2/3 of AEP and thinking what's going on. So you are not alone with if you're experiencing a slower than normal AEP. I will say keep in mind that this is not a horrible year to experience that. And the reason I say that, folks, is because, with that 5-star and the key plan, again, very popular plan available in all 68 counties, and that one plan, a very good plan, we'll be able to write beneficiaries year round. Last year when the Blues had that rating, that 5-star rating, at least once a week, I would get an agent calling me saying, Rob, what do I do? Here's the situation. And I would tell them, look, put them on the Blues, and then take a look at them again during AEP. So I think if we start kind of talking now about how we want to handle the rest of this year outside of AEP, some different ways of marketing, educational, agent, whatever you might want to talk about. I think this is a great year to have that capability to maybe make up for what wasn't accomplished during AEP.
Yeah, no, we're hearing some of the same. And the good thing is, as Rob said, we've got all of next year with the 5-star plan. We've also got some other lead sources that we can certainly direct you to that could be something that could be turned on fairly quickly to start putting in front of additional people. I know between Priority Health and the Kroger stores, we've got other, third party, affiliate community type relationships that we could help plug you into. If any of you have an interest and you're not currently being used, please reach out to our team. We'd love to put you on our list and get you involved with that as well. All right. One last chance, Rob. We'll kind of combine these questions, but again, I know you went through some nice information on the high points of Priority Health, but again, what are you hearing from agents? What are you guys seeing as kind of your real, benefits, high points, the reasons why agents will pick Priority Health for 2023?
Yeah, I think, a big part of that is, service. We're known for service. Our retention rate is 12% higher than the industry average. The access to care, is a big part of that, that retention rate. And it, it gets to the point where it's, you're spinning your wheels, right? If you place your business or who you place your business with, if they can't service your clients to their liking, you're going to lose them, right? Maybe you won't lose them, that carrier will lose them. And then you're spending your time rolling that book over. And so I think what Priority Health does really well is kind of create this environment where we can create this environment that allows the agent to kind of grow their book of business, because we're going to retain, so you will retain your clients at a much better rate than you would if you business somewhere else. And you're going to spend less time renewing that book and more time out growing. I honestly think that those are some of the ways that we really differentiate from some of the other carriers. Access to care, right? What other carriers are doing the same provider directory for their PPO, their HMO, and their DSNP, right? So if you do any work in the DSNP market, that's an area where we really stand out. No in-network referrals, right, for in-network specialists, including the DSNP, but all of our plans, right? I just think some of those ways you see what carriers are doing, particularly in the DSNP market, with some of these outrageous ancillary benefits, and they look great and they're easy sales, and maybe even the beneficiary comes and inquires about them and asks about them, but then, they're unsustainable. Then the carrier makes a change, they pull that benefit away, and now you got to, roll that beneficiary over into something else. And I think it's just kind of a different attitude and different approach with Priority Health. We don't want to offer those benefits that we then eventually have to take away. So it's just more, I think, incremental improvements, every year. And I think that's how we keep our retention where it is, providing good service and access to that care. You can't beat 97% of PCPs, every major health system available in every county, and good solid plans, right? I don't think, we're not that carrier that's going to knock your socks off with flashiness when it comes to, $5,000 of dental or, that type of thing, but they'll be able to access the care that you sold them, right? Maybe it's not 5,000, it's 3,000, right? But it's 3,000 that they can access and they're not going to take away the next year. So it's just kind of that mindset, I think, is where we really differentiate ourselves from the market as a whole.
No, that's great. Those are good tips. And let's not forget the 5-star rating, which is new and will really help both the plan and agents going into next year. Any other, in the last couple minutes we have here, any other tips for success that you can offer to these agents? What are other successful agents doing? Anything you can give to, again, guide some of those who are in attendance today to continue having a successful AEP that would continue throughout next year?
Yeah, I think, this is a year that we're really going to have to get creative, right? I don't know if you guys attended the Medicare Summit right down in Detroit, and they had a couple of people on. There was one lady in particular that was from Texas that I thought was phenomenal. She just came up and had all these different ways as to how she grew her multi-million book of business from nothing, like from nothing. And a lot of it was just being able and finding creative ways to engage in your community. So, I would say think back onto some of those, right? So get involved with your community, volunteer, church. There's a lot of, dedicated to doing a lot of work right now with their community or communities where they have locations where they will host meetings for you, market for meetings for you, provide snacks, for you. So they're doing a lot. I know Oak Street, I imagine, is doing those same things as well. So there's a lot of ways to be able to engage with the community and just make those relationships. Talk to pharmacies, talk to PCPs, talk to dentists, right? And do a lunch and learn. Go in and especially if you have any contacts, right, with any office managers in those areas, come in, do a lunch and learn, and tell the staff, look, here's who I am, here's what I do. If anyone complains about their copays when they're leaving and they're checking out, here's my card. Tell them, this, you seem a little upset, with your current coverage. Maybe this individual can help you, and bring them, donuts every once in a while. Right. There's those little things like that really kind of separate you from the crowd. But if you can develop a couple of relationships like that within the community where you're getting referrals, right? Whether it's accountant, financial planners, group insurance agents, right? A lot of group insurance agencies don't do individual at all. They need them. If you can go to them and say, you do as individual, no conflict of interest there. Develop those relationships, with those guys. Even, work out a referral base. I know one agent who paid half the commissions to a group agent, 3 or 4 group agents, but has a huge book of business now and makes it work. So I think there's a lot of ways to engage. I think the days of just sending out flyers and mailers is gone. The response rate is not where it used to be 2 years ago, prior to COVID and prior to Joe Namath and doing all those marketing. It's just not there. So we're going to have to get engaged in the community and develop relationships to build that referral funnel, if you will.
Yeah, no, those are good tips. And I would say, to add to that, a lot of agents who may be participating in some of our community events that us or the carriers are putting together, those are opportunities you could also be creating on your own. Some of these like affiliate, Kroger stores or, different pharmacies that you mentioned, Rob, we've had agents in some of those locations for years and years. They didn't wait for the carrier to go establish those. They went in, they talked to the store manager, they talked to the pharmacy manager. Again, they presented themselves as a resource for those who are on Medicare, and they've been doing it for years and doing it successfully. So don't be afraid to talk to individuals in the community. Like you said, doctors, we've got different programs going on with a variety of doctors or, networks, but don't wait for them to invite you in. I know I talked to a couple agents pre-AEP, and they've been tied in with some of these hospital systems for years. Those doctors' offices, they go, they drop stuff off, they let them know, and now they've become a referral source for a number of years. So again, make yourself visible in the community.
Yeah, no, exactly. There was one agent that went to high school with a pharmacist, right? And that they let that agent set up shop in their facility. Very clean, simple approach. And they ended up, being in 3 different facilities that these guys were at, and they were writing over time. They were writing 70 apps in AEP just at each location, and it's. Imagine if you go reach out one time a week. You go reach out once a week to a pharmacist, a group agent, a financial planner, whatever. That's over 50, right? 52 opportunities, and let's say even 10% of them or 5% of them say, yeah, this is great. Over the next couple of years, you're going to have a nice funnel built up.
Yep,
so
absolutely. And to add on to that as well, I know some agents with all these new dental benefits embedded in these Medicare Advantage plans. Unlike other years, I know they've had their dentist office, because the dentist office has their network and they can get paid for those services. Yep. It's attractive to them too. they've sent out letters on behalf of the agent saying, hey, you want some dental benefits covered, talk to our agent. I know one agent last year that got 30 enrollments out of his dentist office, just sending out those letters. So there's a number of ways you can do it.
So yeah, think about maybe a new dentist, right, in the area who's looking to build their book of business, right? And go to that new dentist in that area. And the thing is, there, a lot of them are the same networks, but just, re-engineer it and work backwards. There's a lot of opportunity out there, and you don't have to just do flyers and mailers.
And, again, for something a bit more sophisticated, reach out to our team. We have a marketing team. We have experts to help you out with, a number of different, marketing strategies that could turn into lead gen, referrals. So reach out to our team. We can help guide you. And going into next year, that is going to be one of our themes for 2023 is preparing yourself for next AEP, but making it a year-round preparation and not just waiting till a couple months out, but monthly investing time and energy into marketing strategies that will feed you not only throughout the year, but build that book of prospects going into AEP. So your AEP is full and you have obviously continuous business coming in, which leads to more referrals and keeps you, full of, prospects throughout the year. So again, a lot of things we can offer guidance on. Well, I want to thank you, Rob, for joining us today. It looks like that's our time. Thanks for going over some of the high points of Priority Health, as well as some of the industry points. And we appreciate all your efforts out there with us in the field.
Absolutely. Thank you for the opportunity. Appreciate it. You need anything else, or you want to schedule like a walkthrough with that connector, just let me know.
We definitely will. Thanks everyone for joining us. We'll be in touch and hope you have a great rest of your day in AEP.
See you guys.